Okay, so this is a video explaining the use of a low-tech AAC support for patients who use a Passy Muir valve. So this board is designed to be used by a direct selector, and what that means is that the user uses their finger or their hand or any kind of body part to directly point to the symbol that they want to use. So this can be printed out on paper. There are additional directions at the bottom, but I'm going to give a quick overview on the purpose of a support like this and how to use it. So those who use a Passy Muir valve use a trach tube to help them breathe. So that means that there's a tube inserted into their trachea below their vocal folds into their lungs to help them breathe. So this means that they can't generate airflow into their vocal folds for them to produce voicing and for them to speak. So that means they need to have a Passy Muir valve, or in other words, a speaking valve placed on their trach tube for them to speak. And sometimes the valve might not be placed correctly, or their cuff might not be fully deflated. And if this happens, patients can indicate if they're feeling uncomfortable, or if the valve feels good, if they're having trouble breathing, or if their cuff is too tight, they can indicate that as well. And so using something like this, the patient would just directly select, so they would just point to the symbols to create the message that they want to communicate. So they could say something like, I want the speaking valve. Or they could say, the cuff is too tight, or having trouble breathing. So messages like that, specifically just pertaining to using a Passy Muir valve. And I think it's really important because these types of patients aren't able to voice on their own, and if their cuffs aren't fully deflated properly, then they can, and the valve is placed on their trach tube, they will have trouble breathing. It will cut off their airflow. So it's really important that they're able to communicate if they're feeling uncomfortable, if they're having trouble breathing. So I think this could be a beneficial support. If there are any other questions or wonderings about stuff like this, I would recommend contacting a speech language pathologist to learn more about AAC supports.